Here's the PCT's no expense spared annual review, and in page 11 there's a section about the Hoppit, the fact that there was a public consultation process, and the fact that the patients overwhelmingly voted to keep the Hoppit surgery as an independent surgery. They advertised for a new doctor and they found one who seemed to be just the ticket. Meanwhile, the Essex Strategic Health Authority is there in the background, and as you can see, they're backing patient choice, providing of course the patients choose what they've already chosen for them. The new GP with an impeccable reputation arrived, and within a very short space of time we're given to understand that he started talking to the GPs at Lee House Surgery, now called the Danbury Medical Centre, and within a space of about 6 months he had done a deal with them, and the two practices merged, closing the Hoppit surgery and transferring the patients to the porter cabins, and this was done without any further consultation with the patients whatsoever. I was told that this gave the GPs a good reason to go to the PCT and say, look, we're bursting at the seams here, we can't see all these patients in this existing building, we've had to bring in porter cabins, can we please have lots of public money, perhaps £250,000 a year, to build a brand new surgery. And as I understand it, the PCT said yes. So even in pretty little Danbury there were problems, and the patients, needless to say, were not best pleased. Here's one press cutting. The patients weren't happy in the first place because they found out that the PCT had gone to the Lee House Surgery and said to the doctors there, will you look after the Hoppit surgery patients when Dr. Payne retires? And the doctors there said yes. And it was only then that the PCT told the Hoppit patients and staff that that's what they planned to do. And of course at that point the campaign took off. And as I say, the patients fought very hard to save their surgery, and nearly did. Here's another letter from the Essex Chronicle, just showing just how irate and upset the patients became. They'd been told they could keep their surgery, and at the last moment it was snatched away from them. Here's another letter from a patient of some 25 years. Meanwhile, in the same edition of the same paper, Greenwood surgery fights on. In the Chronicle of Thursday, November the 24th, 2005, here's a chap who was on the selection committee. He sets out the events in chronological order, starting with the spring of 2004, and telling the story until 2005, when the new GP took up his appointment, concluding in October 2005 when the patients were told the Hoppit was going to close. In January 2006, Private Eye published a piece about a modern public service. This is the brave new NHS. And it tells the story of the Hoppit surgery. All of which makes it clear that South Woodham isn't the only place that has problems with the Malden PCT. And as for the Hoppit surgery patients in the patient choice era, they rather uncharitably pointed out that their story ended exactly the way the PCT originally planned it. Rather bizarrely, the Malden and South Chelmsford PCT has left the story on its website in the news section. You scroll down. Danbury practice set to continue. The strong views of local people look set to ensure a GP surgery in Danbury continues as a single-handed practice when the current doctor retires next month. Click on that. Mike Harrison, PCT Chief Executive, said the consultation has produced some very positive feedback, and the overwhelming view has been for the Hoppit surgery to continue as a single-handed practice. There is a link between this story and the PCT-run new surgery. One of their doctors is Dr. Juan Munoz, a nice enough chap who previously worked at the Hoppit surgery. When the PCT said that it was going to save the surgery, the Hoppit surgery, and advertise the vacancy, it also gave an undertaking that it would do nothing to destabilise the practice. The first thing that happened was that Dr. Munoz was given notice to quit. He was their long-term fill-in doctor who provided continuity of care for the Hoppit patients, together with Dr. Marilyn Archer. The second thing to happen was that he was offered a job at the new surgery, and he traded in his old banger, and following in the footsteps of another PCT employee at the new surgery, acquired a brand new Audi. So, back to the situation in Southwood and Ferrers, and the fact that we have 4 surgeries, 4 general practices, very, very close to each other. Brickfields, the rest of the surgeries and the pharmacy in the medical centre of the town, and here's Greenwood surgery. The new surgery here. At a cost, remember, of some £70,000 a year. I phoned up this company. That would be the cost of one of these empty premises, and the largest one they had available was at a starting price of $20,000 a year, but that was clearly a haggling price. They were quite clearly going to come down because they've been empty for so long, getting on for a year. And these, remember, are a stone's throw from Greenfield surgery, Brickfield surgery, and the empty units. And here, just on the other side of the square, still in the town centre, is Clement's House surgery. All of which again brings us back to the underlying theme. Why would anyone who was trying to sort out the healthcare needs of a small town like Southwood and Ferrers put a new surgery in the town centre where you're paying a premium price, instead of siting it in a more logical place? Instead of siting it, say, at the station, where paradoxically there's less pressure on parking, where you could cater for the needs of patients from a different part of the town, including those from the Champions Way surgery, which closed down relatively recently. And you could also provide a backup service for the many commuters from other parts of the PCT patch. Why would anyone ignore this option? What's going on here?